Hello and welcome to today's webinar hosted by the Pacific Southwest Mental Health Technology Transfer Center. My name is Rochelle Espiritu and I'll be launching us off today. This webinar is on how implicit bias impacts our work, engaging communities. And as you may know, this is the fourth in a four-part summer series on how implicit bias impacts mental health organizations. I'll just go over a few more. So as a disclaimer, just wanted to note that the views, opinions, and contents expressed in this presentation do not necessarily reflect the views of SAMHSA. And here is our team for today. As I said, my name is Rochelle Espiritu. I serve as the co-director for the Pacific Southwest Mental Health Technology Transfer Center, and I'm a founding partner with Change Matrix. My background's in clinical psychology. I'm a first-generation Filipina, and I've spent most of my career working with racially and ethnically diverse and under-resourced populations in the areas of mental health, substance use, leadership, cultural responsive and equitable evaluation, and in systems change. I'm based in Denver. I'm excited to be on this call today, and I will turn it over to my colleague, Caitlin.
Hi, my name is Caitlin Farrick, and I'm a knowledge transfer specialist with the Pacific Southwest MHTTC. I'm also a change specialist with Change Matrix. My background is in law and early childhood education. I saw some Head Start and early childhood people in the chat box, so that's very exciting. I recently joined the team, having previously worked at the Michigan Department of Education, where I focused on early childhood systems coordination and collaboration.
Great, thank you, Caitlin. And Suganya.
Hi. Good day, everyone. My name is Suganya Sakalingam, and I serve as a knowledge transfer specialist for the Pacific Southwest MHTTC. Like Rochelle, I'm also a founding partner with Change Matrix, which assists organizations in systems transformation through motivating, managing, and measuring change. My background has been in public health, and my focus areas currently in leadership development and in health equity. Thank you.
Thanks, Suganya. So for those of you who are new to the MHTTC network, this is a map of our United States, which is broken down into different regions. The Pacific Southwest MHTTC is part of this national network that provides training and capacity building to our nation in a regional approach. And so our center serves the mental health workforce in Arizona, California, Hawaii, Nevada, and the Pacific Islands of American Samoa, Guam, Marshall Islands, the Federated States of Micronesia, the Northern Mariana Islands, and Palau. I was looking at the registration list and saw that we had a big constituent group from Kentucky. So if you're on here from Kentucky, welcome. Our role here, you can see on the slide, is to provide training and TA that supports the mental health workforce around evidence-based practice. I will just highlight that we also bring a particular focus on culturally appropriate mental health prevention, treatment, and recovery strategies. We do this through a variety of services. So you can see here the different ways that we offer training and TA that you can access through our center. So here's our agenda for our time together. We're doing introductions. It's great to see where everybody is from in the chat box and the organizations that you're with. We'll do a little ground setting. So we'll go through a couple of terms that we're going to be using through the webinar today. We'll also be looking at then how implicit bias impacts our community engagement and connections with diverse communities that we serve. We'll also spend a little time talking about the impact of our pandemics on the communities and want you to leave with some strategies around how to combat implicit bias when engaging with culturally diverse communities. So you're all doing this already, but if you'd like to add in another thing that you're hoping to learn from this session, we'd welcome that and would like to see what interests you come into this space with. So feel free to type in something that you're hoping to learn from this session, and we will do our best to answer them as we can. I'm going to go ahead and turn it over to Caitlin. Oh, and Joanne, before we do this, I'm going to have to show my screen, but we didn't practice this beforehand, so if you can let me do that, that would be great. Katie, do you want to start us off?
Great, thank you, Rochelle. Yep, great. Thank you. So today we're going, instead of using our chat box, we're going to use a tool called Poll Everywhere to collect your thoughts. In just a minute, a screen will pop up. Joanne's working on that, and it will show a website that's called Poll Everywhere. It's a polling website. Essentially, what we're asking is for you to go to this website. I can't see the web address right now.
Sorry, I'm pulling it up. Here we go.
It is, yep. You can wait for just a second. So if you respond at pollev.com/changematrix335, or you can text change matrix 335 to 22333. You can text, or you can type the address into your browser. I will also type it in. What we're asking you is to offer one word that comes to mind when you hear the word implicit bias. So we're hoping for one word. If you want to use two, if you could just kind of like a dash instead of having two separate words, that would be helpful because it does split up the words. The word cloud technology only allows for one word to be captured.
And so what happens is if multiple people submit the same word, what you see is the word becomes larger, so you can see what words are most commonly being submitted.
Yep. So it looks like a lot of people are using the word unconscious, unknown, judgment, stereotypes, but unconscious is the biggest right now, unaware. And in the chat comment box, we're also getting some comments: judgment, reflex, barrier, microaggression, discrimination, ignorance. And our word cloud, unconscious, harmful, is also becoming larger. Great. So yes, lots of unconscious and unaware. So I wonder, Rochelle, if we want to close that. And we're going to offer our definition of implicit bias. So while Rochelle's transition, there we go. Thank you, Rochelle. What is implicit bias? So implicit or subconscious bias refers to the attitudes or stereotypes that affect our understanding, our actions, and our decisions in an unconscious manner. So like many of you stated, unconscious, people often think of that when they think of implicit bias. A few things about implicit bias: they're robust and pervasive. Our brain actually needs them to help us function. Implicit and explicit bias, so biases we're aware of, are related, but they're distinct mental constructs. They don't necessarily align with our declared beliefs. We generally hold implicit biases that favor people like us or those in our own in-group. Implicit biases have real-world effects on our behavior. And one of the good things about implicit bias, or good things to keep in mind, is that implicit biases are malleable, and so they can be unlearned. And we really can't underscore enough that implicit bias is unconscious and involuntary. We all have bias, and they can be positive or negative. It's just how our brains operate. And if you're interested in a deeper dive on the fundamentals of implicit bias, please consider viewing the recording of the first webinar in this series, which focuses on the role of the individual in combating bias in mental health settings. So now, a couple of you mentioned the word microaggression. So we're going to take a moment to ground ourselves in what microaggressions are. So imagine these scenarios, if you will. After a presentation, a white employee tells her Latinx colleague that they are so articulate. A classmate remarks to their peers that they do not look like a lesbian. While working on a grant proposal, someone asks their Asian colleague who does not work in a business or numbers role to help them with the budget because Asians are so good at math. There's a name for what's happening in these situations, and this is when a bias shows up in our behavior and it leaves people feeling uncomfortable or insulted, and that's microaggressions. Microaggressions are the kinds of remarks, questions, or actions that are painful because they have to do with a person's membership in a group that is discriminated against or subject to stereotypes. And a key part of what makes them so disconcerting or harmful is that they happen casually, frequently, and often without any harm intended in everyday life. And sometimes microaggressions might seem like a compliment, like the above example of the employee asking their Asian coworker for help on a math issue. However, this is still a manifestation of a bias, and it ignores somebody's individual attributes, perpetuates stereotypes, describing intelligence, and excludes those who do not fit the stereotype of Asians being really good at math. It also ignores the diversity among Asians and Asian Americans. So psychiatrist and Harvard professor Chester Pierce first coined the term microaggressions in 1970 to describe insults and dismissals he witnessed non-Black Americans inflicting on Black Americans. And Daryl W. Sue further described the term as the everyday slight, indignities, put-downs, and insults that people of color, women, LGBT populations, or those who are marginalized experience in their day-to-day interactions with people. So the next term that we're going to talk about is community engagement. And here you'll see two definitions. Community refers to intended beneficiaries and their families, friends, neighbors, and leaders of small community-based or faith-based groups who work most closely with them in the place they live. And community engagement is the process of working collaboratively with and through groups of people affiliated by geographic proximity, special interest, or similar situations to address issues affecting the well-being of those people. It is a powerful vehicle for bringing about environmental and behavioral changes. So there are many definitions for community engagement, and one is offered on the slide. But simply put, community engagement seeks to better engage the community to achieve long-term and sustainable outcomes. In our case, mental health outcomes, processes, relationships, discourse, decision-making, or implementation. And engagement is generally not driven by a model so much as by a framework of guiding principles, strategies, and approaches. And it's based on principles that respect the right of all community members to be informed, consulted, involved, and empowered. And community engagement employs a range of tools and strategies to ensure success. Fostering and sustaining trust is also a critical element for successful engagement and governance. Community engagement can be viewed as a strategic process with the specific purpose of working with identified groups of people, whether they're connected by geography, special interest, or another affiliation. Community doesn't mean one thing. In mental health work, community could be those in recovery or those struggling with mental illness. A community we may want to reach out to may be those experiencing homelessness. It's not necessarily race or ethnicity based. A key way of thinking about community engagement, I really like this, is putting community and engagement together broadens the scope, shifting the focus from the individual to the collective, which has implications for our work and inclusiveness. It's not just about including one person in a group to represent the community, which can sometimes feel like tokenization, but to engage the community at large. So now we're going to social ecological model of health. Sorry, I couldn't talk for a moment there. Human beings don't exist in a vacuum. We're influenced by our physical environment, the larger society we live in, and our relationships with our family, our friends, and our community members. Similarly, a person's mental health and mental health treatment does not exist in isolation. For example, I may be influenced by the norms around mental health treatment in my community, and that may lead me to be wary of seeking treatment. The social ecological model of health is a conceptual framework within which improvements in health and well-being are achieved by addressing the social, economic, and environmental determinations of health. The model is based on the understanding that in order for health gains to occur, social, economic, and environmental determinants must be addressed at all levels of our society and being. One way to think about this is through the lens of childhood mental health. We don't view the child as existing in isolation or treat them as on their own, but rather we look to their family, their school, and their environment as contributing to the success of their treatment. The social model of health examines all the factors which contribute to health, such as social, cultural, political, and our environment. And understands that the human body is more than biology, but it's built, again, like I said before, it's built up and bound with the different relationships we have. So that could be biological, social, psychological, cultural, and individual processes. In order to address these social factors, health and mental health organizations need to engage with diverse communities in authentic ways. This is especially true when working with youth and young adults. Youth and young adults are sometimes left out of the equation that we consider engagement with communities and society at large. They're making healthcare decisions either as individuals or as members of a family, and in considering community engagement, their voices must be heard. So one of the things to keep in mind around community engagement is that it's both an art and a science. And this is a little cartoon in case you have some trouble seeing it. There is education, consultation, communication, partnership. The little person on the right is saying it's all engagement. So community engagement is a blend of science and art. The science comes from sociology, public policy, political science, as well as from organizing, so community organizing concepts, including community development, constituency building, and community psychology. The art, if you will, is understanding, skill, and sensitivity used to apply and adapt the science in ways that fit the community and the purposes of specific engagement efforts. So again, it's not a one-size-fits-all. You have to understand your community and the ways to work and the best way to work with them. In mental health or human services, we sometimes assume that people understand community engagement because we regularly interact with clients. However, this is not always true. Community engagement can be complex and labor-intensive and requires dedicated resources such as time, funding, training, and skilled people, which comes from training. Building and implementing effective strategies requires a solid grounding in the best tools, techniques, and information available. And I am going to turn it over to Siganya to continue our conversation around community engagement.
Thank you. So one of the things that sometimes we all have a different idea of what community engagement is. And so I have really liked this particular schematic because it really shows the different things that we can do, which are all considered community engagement, but the level of involvement and the requirement for trust and communication can be very, very different. And so one of the things that I wanted to be able to share with you is that an understanding that how we communicate in our communities is a continuum. It shows a way in which we can collaborate towards a higher, greater involvement with the community. When community engagement to be achieved in a very short time limited project, we need to identify which aspects of community engagement are going to be very critical. One of the things that we do know is that the most effective way of doing the work we do of promoting and prevention and intervention in our communities is a long-term relationship. And in order for a long-term relationship, we sort of have to follow this arrow to actually creating a shared leadership process, because that is what is going to really allow for true meaningful community engagement. And we will see as we listen to this webinar why then implicit bias can impact the process of community engagement. I'd like to just be able to show you a little flow in terms of, let's see. Okay, so one of the things that we know is if all we want to do is outreach, we need to provide the community with information. If however, we want to make a real difference, then we need to engage them in the final decision making at the community level so that they really get a sense that they are equal in the partnership, and therefore you're going to get the buy-in that you're going to need. And this is working with members at large in the community. You can also think of it in the work that you might do with different organizations in the community, because if you're really going to make a difference, as we know, around determinants of health, it can't be just one organization, the health organization, working in the community. It has to be multiple organizations and systems like housing, education, transportation, and therefore, at the lowest level of community engagement, all you might have is a list of other entities that coexist in the community. But if you really want a deeper engagement and to make a true transformation, then you're going to want to be in this place of shared leadership where the entities have formed strong partnership structures. For any of you who have heard and are interested in collective impact, or have even been a part of a collective impact initiative, one of the things we learn very quickly is that there are multiple organizations within a community, but they all, in order to make a true difference and to really truly engage in the community, they all come together. And that is what can cause the kinds of transformation in our communities that we need if we are going to make a difference and address disparities. The other thing that we need to remember as we think about implicit bias and community engagement is how do we get to the models, the mental models or the assumptions that we have about people, about different communities, about different groups of people. One of the things that is helpful is understanding this ladder of inference. It was first developed by Chris Agarth in about 1970. And to him, he stated that the ladder of inference is a way of describing how you move from one piece of data, like for instance, a comment you hear or something that you have seen, and take it from that point through a series of mental processes to conclusion. And you start with first selecting the data. And truly, one of the things to remember about selecting data is that you will select the data that makes the most sense to you from your worldview, from your cultural lens. And you're probably not even aware that you're choosing the data that you have selected. And one of the things you then do is you take that information, and based on that information, you make interpretations, and then those interpretations lead you to make some assumptions, and based on those assumptions you'll make the kinds of conclusions and decisions. And what they will do is they'll go to reinforce your belief, and therefore it'll set up the kind of actions you want. And one of the things about this is that this is a cyclic process. Once we do certain things, they then become facts, and then they become reality, and then we go back and start the cycle again. I tried to make that more explicit in kind of walking through a process here. And so here, Aisha arranges to meet Maria for coffee at 10:30. Maria is late and does not explain why. In fact, she doesn't even seem to have noticed that she's late at all. So Aisha is gathering that information based on what Maria has done and what she hasn't done, which is explain a delay. Aisha decides that Maria simply couldn't be bothered to turn up on time, and that Maria values her own time more highly than Aisha's. And so this is the assumption she's made, and this is based on what she's experienced and what she sees as facts. And then Aisha concludes that it's not worth bothering to meet up in the future because Maria obviously doesn't want to see her. And so that is her conclusion. And so what happens then is, and I'm sorry for this typo, it should have been Maria. When Maria suggests meeting the next week, Aisha makes an excuse to avoid it. So you can see how certain things escalates into certain beliefs and actions, because one of the things we haven't done is we haven't validated the information. And therefore, that is one of the most critical aspects of this work. And so in the next slide, what I want to be able to talk to you about is what are some of those assumptions that we make in the work we do around community engagement. One, we think that the capacity and ability of different stakeholders, we make assumptions about it. We don't often check it. We just say, oh, this is a group of people. Oh, they English is a second language. So, and then we go on. We create these narratives. This concept of hard to reach. It's hard to reach from whose perspective, from what perspective. Assumptions that there are all kinds of community infrastructure and levels of infrastructure, that there are certain people who have informal leadership roles and others who have more formal leadership roles, who are the people who are the decision makers. So we make these assumptions, and we may not have validated them. And so, again, the concept that there might be intergroup conflicts. We might sometimes have this notion that certain groups prefer not to connect with the rest of the world, and they want to stay isolated, and they would like to be, just left alone, or other cultural misinformation or biased information. Or we may make assumptions of literacy and numeracy levels and dominance of oral cultures. I have so many times I've been in organizations that say, we truly are being very culturally and linguistically competent. We have taken this document and we have translated it and printed it in 15 different languages. The only issue is, have they determined that some of these are literal languages, or are these oral languages, and the communication is mostly oral, and people don't really they go more by word of mouth than they go by seeing a document that is written up. So again, because as Caitlin said, this is very unconscious. We don't know about it. It comes from our own sort of childhood conditioning and our worldview and our cultural lenses, that we forget that we have some of these biases. So one of the things that we would like you to do is, if you could share, can you think of assumptions, biases that might impact your organizational engagement with diverse communities? So we have it set up here. So if you just type it in, we will collect this information and we'll be able to see some of your responses. People who can't read don't need paperwork. Low income equals low education. Perceptions that efforts are not welcomed. Perceptions that efforts, what else? People who, homeless have other choices. Preferences for in-person communication. Addiction is a choice. A belief that Native communities need others to help them, that they can't help themselves. These are great. So you can see how we already, in our work, in wanting to engage with communities, we already walk in with these kinds of thoughts in our heads. And so the notion that we really then have to intentionally check and determine what these biases are before we can engage in our communities becomes very important. I am now going to sort of turn this over to our next slide, so that one of the things that we can do is have Rochelle explore this more with us.
Thanks, Siganya and Caitlin. So it was interesting to see the different responses that folks did put into that poll. And as Saganya mentioned, these are quick assessments that we tend to make about people or about situations sometimes without us realizing that we do so. And we kind of asked you to make it more explicit by writing, but oftentimes our brain is just operating so efficiently that we don't always interpret or make the implicit explicit so that we can really see how that might be impacting our work, our interactions, because we're just not even aware of how these views or opinions might be having an impact on our work. But so what's clear is that our biases and even microaggressions that we might have do impact our work with clients and with our own colleagues and in the community. Our previous webinars did talk about kind of starting from the individual and then looked at how implicit bias impacts our relationship with providers and within organizations, and now we're looking at how does this impact our work with communities. So we do know that we need to really think about how we can include a variety of voices, of perspectives into our work, because this is often what helps us mitigate our biases. It helps challenge the way that we're thinking. And so that's why community engagement is so important for organizations, because really this is what helps bring new ideas or new understanding about what communities are experiencing or what their history might be. And so bringing in community members who are most closely impacted by the problems that we're trying to solve is so important. We also know that when we don't check these kind of individual biases, that it can permeate into an organization and really impact the culture and the climate of the organization. And that was something we discussed in our third webinar on July 22nd. So encourage you to take a look at that one as well. So as we think about implicit bias and microaggressions with community engagement, we wanted to focus on a couple of bucket areas, because there could be so many different aspects that we look at, and it does impact how we engage with community in different ways. But things to think about are your leadership and governance. For instance, if you have a very homogeneous board, or you always rely maybe on the same person to represent kind of the whole community or any kind of community, that might be something to check for yourself, because you know, leaning on one person, while it's a good start, isn't always going to be the most helpful way to represent what a community is experiencing. Or maybe you might even consider thinking about how those with lived experience can help with your workforce capacity. So how you might develop training for your staff with community engagement can really offer different perspectives into the work. And so that could be an important strategy to consider. And then we'll look at some things around policy and infrastructure, because what's worrisome, I think what we have to be very vigilant about, is when our implicit biases kind of permeate into our policies and infrastructure, and we know that they do. So we want to explore that during the rest of this webinar. So these are the three buckets that we'll be looking at, how bias comes up in these areas and how mental health organizations can combat these different kinds, the bias in these different areas. So I'm going to go ahead and introduce a guest speaker that we're excited to have join today to help explore these domains. And so Tiffany is from the Nord Center in Lorraine, Ohio. They're a private nonprofit agency that provides comprehensive behavioral and mental health services to children, adolescents, and adults. So they do have a variety of outpatient counseling services like sexual assault, rape crisis services, and drug and alcohol addiction. And they also provide culturally specific services to bilingual and African American consumers. So we're glad to have Tiffany here, who brings experience with community-based counseling in the areas of first episode psychosis, extreme and severe mental illness, and hoarding. She was a case manager prior to receiving her master's degree from Liberty University. And I will let her share a little bit more about herself and the center.
Hello, and thank you so much for that. So at the North Center, as was just said, is we are a nonprofit community mental health agency. And some of the things that we have been working on is just trying to engage our community a little bit better, giving a safe place for the clients to come and really break down some of those barriers of the stigma of mental health. Something that we have actively been working on is developing a group, which you can see on your screen. It's called the Affinity Group, and it's a training program to educate on multicultural differences. And the purpose of this group started as a community environment, trying to have this group for clients, and even if you weren't clients of the North Center. Starting off, we are presenting this program to really work with the staff and employees on their own implicit biases, and really trying to build that environment of allies, and it's starting with the African American community. It's a 12-week program, and through this time we go over labels, stereotypes, racism, anti-racism, and many other topics that provide education, research, and some interventions to really help the ally group and the cultural group into being able to work together on breaking down those cultural barriers and building some understanding of individual biases. But then at the end of that group, working together to really be able to acknowledge those biases and develop a good team ethical standpoint for when we work with the community. And that's also important for when those clients come into our offices and we are aware of our own individual biases and how they impact the services we provide to our diverse community.
So thank you so much. Are you still speaking? Sorry.
Yeah, no, it's okay. So within our agency, what we also have been working on with the CEO and the board is really trying to increase our outreach and our collaboration with other agencies and other resources in the community, whether they're medical, maternal and child development, educational, and just really trying to bring the community together as a whole along with this group so that we can continue those services and actually provide efficient and effective care.
Thank you, Tiffany.
Thank you.
I didn't want to speak over you again. So now we're going to talk about leadership and governance, which is one of our main buckets of how we're going to frame this. So meaningfully engaging communities and mitigating bias requires that leadership values communities as essential allies in achieving its overall goals. Leadership and governance, for it to be effective with community engagement, effectively means that leadership has to relinquish or share power at various levels within the organization. Shared power is an integral principle of leadership development, and it's an essential element for community engagement. Concerted effort should be directed towards cultivating leadership within communities. We'll talk more about this, but community engagement in leadership and governance can happen in a variety of ways. And we shared some of those a little earlier, such as requiring community members and those with lived experience on our organizational boards. So some of you are probably familiar with federally qualified health centers, and for federally qualified health centers, it's mandated that 51%, so just more than half of their board, be derived from the community that they serve. And mental health organizations and other human service agencies who may see similar requirements or recommendations, like Head Start, some of you who are from that community. For example, it may be a requirement or recommendation that boards and committees include those with lived experience. Supporting community leadership through partnership with community organizations or mentorship can greatly benefit the community and your organization. So when others in the community are strengthened and able to accomplish things on their own, they and their community thrive. And cultivating and increasing knowledge leadership capacity is an indispensable strategy for engaging diverse communities in the goal to eliminate racial and ethnic disparities in health. So on our next slide, we are offering some strategies for disrupting bias in leadership and governance. So some strategies for mitigating bias in community engagement from an organizational leadership and governance perspective include cultivating an organizational culture that values and honors the contributions of community stakeholders and finds innovative ways to include them in organizational initiatives. And really, we all come from cultivate and requiring community membership in the organizational governance structure, so we talked about that. And one of the reasons that that's important to have diverse representation on your boards is that this minimizes unconscious confirmation biases. So you don't have just one voice at the table and one point of view, and this can really mitigate bias. Find trusted community partners who might not always be visible so that you are hearing diverse, unbiased perspectives of the community and of the services that you provide. Undertaking robust stakeholder engagement efforts focused on understanding perceptions of mental health and well-being held by local people and communities, the wider issues impacting mental health treatment and service access and community assets. So it's really important to hear from the community what their challenges are, how they view mental health, and also what they see as their strengths and their assets. Inviting local community champions and partner organizations to share their cultural beliefs and practices to increase your organizational knowledge is another strategy. And then collecting qualitative and quantitative community data that you can disaggregate. Saganya talked about that before. Data collection is sometimes overlooked, and it's so important. It's really critical for your organization. So another aspect of leadership and governance that's important is understanding the situatedness of power dynamics. So we all come from different places, different neighborhoods, countries, cultural backgrounds, educational backgrounds. There's a lot of things that make us who we are and where we're from. As a result, we're all situated differently. And as such, we bring different knowledge, perspectives, kinds of leadership, and access to power. This is all of what is needed to build collective power. However, sometimes our differences, as you've probably experienced, can bring about tensions. So in traditional approaches to building power, organizers look for existing common interests, and that builds transactional power. So it's based on a time-limited exchange that leaves the underlying structure intact. But if we're really looking to make a difference and really transform a system or a structure, then we really need to we can respond with interventions that transform the structure itself. This builds transformational power, and we need this transformative power to change our currently unequal systems. So one thing Saganya found that I thought was really great from an organizational leadership capacity is this commitment statement. And so if you're a leader in your organization or you regularly communicate with leaders in your organization, this is something that your organization can take on, making this really explicit commitment and embarking on this leadership development journey with others in your professional network or workplace. Make a commitment for incorporating equity, diversity, and inclusion throughout your organizational structure. And it could look a little different than this, but this is a starting point to start thinking about how you can elevate diversity, equity, inclusion in your organization. And so now I'm going to ask Tiffany if she can share some examples of how her work is influencing leadership and governance.
Hi again. So something that the North Center has been doing, and not just in our specific agency, but within our county, is really being able to engage all of the community resources into one, being able to have those conversations together and to be able to look at the complications that's going on in the community so we can best give resources. something that is actively working on is a committee specifically at the North Center to be able to bring in a consulting agency and look at where can we best provide services, what are some new things that we're not looking at, and to really just give us that third view to really help us go into the community and see where we can make the best changes for the agency. Now there's also a 2020 and 2021 Lorraine County program that they're looking at trying to incorporate all of the hospitals, the educational system, and mental health to be able to provide all of these many resources to the vast of the community. What that includes is being able for clients who are looking for mental health assistance to have that access, whether it's in their children's school, with their doctor's appointments, even as far as the justice system and within the jails. Just being able to work as a full-on community and looking at what are we not seeing from our view and talking with that consulting agency with where can we make the changes, and starting with where can we build that educational process with identifying the providers of our own biases, so that when we do go out and we do include community members into many of the systems that we're working on, we're culturally aware of what is needed and culturally aware of where we stand and educating ourselves so that we can help.
Sorry, I got disconnected for 1 second. So now what we're going to do is I'm going to ask you to share your thoughts. And so what are other strategies that you might use to mitigate bias in community engagement via leadership and governance? Tiffany shared a couple of excellent ways that they're doing this at the Nord Center, but I'm wondering about strategies that you may use in your programs and services around leadership and governance. I'll just pause for a moment. So we have a response. Create space to name or identify when microaggressions happen. That's great. So working with leadership, or leadership allows for space to name or identify when microaggressions occur. That's really important. Here we have policy for board composition to include community representation. That's another great strategy. Great. Well, if you think of other things that you're doing at your organization, because I know you're all doing wonderful work in your communities, you can also take a moment, oh, here's one, admit not knowing and being open to input. Leadership taking upon themselves to attend trainings and learn about bias. That's really important. We talk a lot about that, how it's really critical for all levels of the organization. That includes leadership, that includes your administrative staff or your billing staff if you do billing. All different levels being included in your training around bias and cultural competence and other key concepts, including community engagement. So if other ideas occur to you, you can always type in the comments box, but I think I'm going to turn it over to Saganya. Talk about workforce.
Mute, Saganya.
Okay, muted myself and forgot that. Thank you, Rochelle.
I was just saying I wanted to thank everyone for sharing their ideas about strategies that we are undertaking. And also remember that it's like some things that it's not like we have all this set up in a plan that we can just follow. I think that one of the things that we'll be learning through this process together is that when we are trying to address implicit bias in our organizations from multiple perspectives, including community engagement, we're going to be able, we might determine and identify strategies that work, might put it into practice, and through an iterative process find aspects of it work, other aspects of it may not work. So it's not to say that we all have the answers right here and there, and it's of course going to be different for each one of our communities. But I think knowing and being intentional about addressing bias as we engage in the community is very, very critical. So it is with that in mind that we're going to talk about the second bucket of activities, which is around workforce capacity and development. One of the things that we can think about is that it can permeate, bias can permeate engagement, in terms of workforce development when we, don't take into consideration the bias and attitudes that might prevail in our staff, and that if this isn't addressed in our trainings, unfortunately, it will sort of lead into any work that we do in our communities. One of the other things that we might need to think about is to integrate cultural humility and curiosity as part of the training of our staff when we are involved in community engagement activities. And clearly, being able to go into the community humble in terms of acknowledging that you don't have expertise of the community and the cultures and the groups in the communities, but you want to know and you want to learn and you want to be able to work effectively with them. And the other bias that could occur is if we don't intentionally find ways to experience diverse experiences and opportunities for connecting with communities. One of the ways in which we try to mitigate this in our organization is actually ask people if they wanted to go out and spend and volunteer time in the community, that we would take that into consideration in terms of their workload. The other thing is we encouraged people within our organization to attend health fairs and community events in the community as part of their work, so that they were getting to understand and know communities more effectively. The thing to remember is that workforce development activities need to ensure that in project descriptions and personnel performance measures, there is an inclusion in terms of areas of knowledge and skill sets related to community engagement, and then resources for in-service, continuing education, and professional development, which will allow for an increase in capacity for collaboration and partnership with culturally and linguistically diverse communities. So this is the critical aspect of what a community, an organization can do. So some of the things that we can do in terms of disrupting bias, working in communities, is that we can require all staff to attend anti-bias, cultural humility, and community engagement training. We can focus on increasing the knowledge of our staff by having them be part of events in the community. Being able to, if staff volunteer, encourage that to happen. And the other thing, and Katie mentioned it earlier too, is invite community leaders to staff development days and be able to share information about their own community and their own cultures, and then really to partner with community organizations in integrating peer support and those with lived experience into our organizational service capacity. I think that these are different ways by which we can really mitigate the bias that can occur in the workplace. As workplace development is part of work force capacity development is also providing people with skill sets. And one of those skill sets is to be able to address bias when they see it. And so this is a great tool that is offered by Chung, Ganot, and Sousa, and it really looks at what do we do when we come across a bias and microaggressions. And so one of the things to do is looking at unconscious bias and breaking that habit. So this tool is one that will allow us to break existing habits of thought that then lead to sort of biased behavior in terms of what we state and what we do. The prejudice habit breaking intervention has been developed to produce long-term change, and by looking at bias as a habit that can be broken by increasing awareness and concern about bias. So Katie had mentioned earlier is that the fact that we have bias is a fact, but we can break that. We can change that. It is malleable. It's not fixed. And so this notion of being able to mitigate that bias, remove that bias by increasing our own awareness and recognition that we do not want to be biased, understanding our own role in perpetuating bias, and then instilling motivation to overcome bias. And then, as always, you know, if we want people to do this, we have to give them tools by which they can do that. And this is why this is a really good tool. It's called the action tool. And really, it starts by asking clarifying questions, moving on to listening, telling, impact, owning, and next step. And I was trying to think about how do we make this in sort of relevant to all of us. And so if you would want to close your eyes and visualize this, okay? You are in a Zoom meeting, just like the one you're in now, except this is with your work team, and your team lead starts the meeting by having everyone participate in a connector activity. Many of you know this. We are all doing Zoom meetings, and we all recognize that we're not face-to-face, and so we're trying to create a way in which to connect with each other. So the connector activity is watching a video. This activity is to estimate the number of times a ball gets thrown by folks wearing white in the brief video. So a member of the team mutters and then says aloud, "Oh, that should be easy for Alai." There is a brief silence. Then the team lead starts the video. So can anyone share with us? And I would love if you could just unmute yourself and share this, because it's much easier if you can talk about this verbally. If we were to use this tool, what would we do? What might be the very first thing we would want to do?
Suganya, sorry, participants can't unmute, so I think what we'll do is we'll invite people to put it into.
Yeah, sorry, Joanne. I sometimes forget that I'm not in Zoom, and so what would be a first step? Can people write in the chat box?
Yeah, and so maybe it's around the A first, Suganya. So you know, if you look at that as ask clarifying questions, maybe like what might you ask if you had heard a member of your team say something that felt like a microaggression. In this case, Suganya used the experience of somebody saying, "Well, that should be easy for a lie."
Exactly. And there's no right or wrong comment to make. We're all doing this together, so it's a very helpful learning process for all of us.
Yeah. Suganya, I would just share that oftentimes, right, I think we've all been in these situations where you hear someone say something that just makes you cringe or makes your stomach hurt. And I think the purpose of this action method is that it makes us think more intentionally about tools that we can use or questions that we can ask that are, for the A1, like asking from a place of curiosity. So I'm seeing some nice examples, Suganya,
yes.
if you want to.
Let's see. I think it's Marianne who says, can we tell, okay, I don't understand your comment. Can you tell me more about what you meant? Okay, that's great. Ask person for clarification as to what they meant. If the group has already talked about microaggressions, you can bring that into the speaker's awareness. What do you think makes it easier for X? Okay, so as you can see, what you're doing is, and this is the hard part, as Rochelle said, we hear something, we feel it's, we are uncomfortable with it, and we don't quite know what to do. And the first simple thing is asking questions, not with any intention behind it, but to really just say, I'm really curious, what did you mean by that? What were you thinking when you said that? Could you explain that further? That then opens up the rest of all of these other steps, being able to listen carefully, and listening carefully means putting aside your own biases. We all have them. We have to be intentional about that. And then telling others, like restating what you heard, and then noting why that felt problematic to you, and then taking into consideration what that might mean to you and to others around you who are listening, and then to sort of owning your own response, which I think is also equally important, and then being able to suggest next steps. So these are things that are tools that we can use. This is something our workforce can be trained to do effectively so that they are able to address bias. I'm going to ask at this point for Tiffany to also sort of share with some of the microaggressions, and we also have shared some microaggression strategies here. But Tiffany, if you could share things that are related to what you're doing around workforce development, that would be great.
Yeah, so as presented earlier, the Affinity Group that we are developing was intended for the community, but we're using it for the staff at the agency of the North Center to really look at what are those microaggressions, what are those biases that we hold so that we can challenge them. And something that we have learned just through being in this agency is the biases that's held against the agency. In past, we haven't been as in the community as we're working towards right now. And some of the beliefs that have been formed around the agency, as it is known for its crisis unit and being the only crisis hotline for the county. So oftentimes, individuals relate the North Center to a crisis situation which could lead to a hospitalization. And that deters clients from wanting to come in for counseling or pharmacological management or even other resources that we do provide, and looking at what are those biases around the agency and how can we combat that with understanding the biases that we hold and understanding possible beliefs that's held within the community. So being able to go out in the community after our trainings and talk with community members, go to local government meetings, and recently I was at a Unity rally just to make our presence known so that we can break that thought of we are only just for a crisis situation. One of the big things the North Center works on is preventative care, not just when you're in a crisis, but to help before that crisis occurs and to be able to bring those tools to the community. So looking at what those microaggressions are within our staff themselves and having that environment. So if a staff member is experiencing something or has that uncomfortable feeling, we too have that safe place to be able to bring that to leadership, supervision, and even co-workers so that we can better work within the agency and take that out into the community with that level of understanding.
Thank you. That's such a great strategy. So I'm going to turn this over now to Rochelle, who's going to talk about policies and infrastructures.
Thanks, Siganya and Tiffany. So I said this earlier, but we really do need to be quite vigilant about how biases can permeate into our policies and our infrastructure, and then therefore unknowingly impact our engagement with communities. And so at the really highest level, we would encourage organizations to really look at your vision, your mission, your value statements, and how do they clearly indicate the value of meaningful community engagement. And I know sometimes we ask folks to pack so much into these statements and these values, but at the same time, I think the thing to think about is if you're not stating anything, are you implicitly then kind of devaluing community engagement in the way that your organization operates? So let's look at some ways that you might think about in your organization to create some policies and or infrastructure that help to disrupt any bias that might exist. So one of the things that we often suggest is really looking at how we set aside resources, both for staff to engage in communities as well as for communities to engage in organization. So I think we're finding that right now, especially with COVID, we're in this time of heightened awareness around racial injustices. And so I know in my work, there's a lot of organizations and people that are recognizing the value of engaging diverse racial and ethnic voices in their work. And so a lot of communities are being tapped right now. I think the thing to think about is like, how do you show value for that kind of experience in your organization when you're reaching out to communities? Are you supporting that work through monetarily and honoring that voice and the experience, either through contracts or through stipends or through in-kind resources that you're able to support? Because we as organizations do pay for expertise, and so kind of recognizing the expertise that that community members bring is just as important also. I think another thing to think about is how might you in your organization think about having some engagement goals as a performance measure. There's that, the saying that what gets measured gets done. And I think that is absolutely the case for community engagement too, is that it's important to define as an organization what would success look like if you had authentically engaged community, and what would it look like from the other end? What would community members say success looks like if they felt like they've been engaged in meaningful ways? So important to look at that. I think that policies are important because they help institutionalize these kinds of efforts, and they don't go away then when your executive director changes or when you've had leadership changes. And so it is a commitment that an organization can make. And then you can see some other ideas too on the right around infrastructure and how community voice can really help. I have a background in evaluation, and so I'm always eager to look at how do we use our data, how do we disrupt the way we think about data in our work too, so that we're not always having the white population as the standard, right? That we're always comparing other racial or ethnic groups to white as a group, and maybe we should be thinking about that differently, and how can you do that in your organization? So these are just a couple of ideas to consider. I'm going to go quickly because I think we're running over a little here in time, but This is one way to look at data also. So this is a map that shows an area in Las Vegas that shows life expectancy at birth in years, with the red boxes kind of depicting areas with shorter life expectancy. So potentially as an organization in Las Vegas, how might you look at this data to rethink where you provide services, who you provide services to, understanding what might be some of the factors that are leading to certain areas in Las Vegas based on zip code having lower life expectancy. And so using that data can help inform the policies and the ways in which you think about providing your services. Really quick, I think we've made a lot of movement in our country around recognizing our biases towards physical ableism. And so as you look at these 3 different pictures, you can see that these different structures have different meaning for people with different needs within their community. And so, sorry, I'm going to move this back, unless somebody was telling me I really need to go faster now. So what you can see is that sometimes we think about policies being universal. In other words, kind of applying to all individuals equally, which means that we're kind of basing this on the idea that all individuals will have equal benefit. But as you can see from here, if you provide a stairway for somebody, it's not going to work for somebody who is in a wheelchair. So it's the same idea for mental health services. If we think that all clients with severe anxiety should have the same access to the same evidence-based practice, and assume that every client will then have an equal chance of improved outcomes, we're going to be wrong, because oftentimes we know too that not all EBPs are created equally. Many evidence-based practices have not been normed on populations of color or for people from different racial ethnic groups. So it's really important to challenge the assumptions around that as well. So I will go ahead and move on now. So actually, I will invite Tiffany first to share any ideas or thoughts that they're doing in the Nord Center to help mitigate bias in policy.
Yeah, so some of the things that we have been working on is increasing our PHQ, which is the patient health questionnaire, to make that a little bit more diverse, so that when other individuals or when the clients are doing the screening, we can actually look at the many ways, say, depression can be seen through other cultural areas. And then I think the biggest thing within the agents is really giving them the environment to speak about what those microaggressions are and what those biases are. A lot of times when something is spoken, it's kind of taboo to actually bring it out into the open. We kind of want to just leave it under the rug. But having that safe space within the agency to talk about what those things are, keeping a continuous wheel of education and trainings, and just having a very open communication of environment to go over what are we feeling about the microaggressions that we're experiencing in the work area, and then how can we take this knowledge that we're building and utilize that for our clients. If we have a client that we realize there's some countertransference and there's some biases there, where can we go as staff members to be able to talk about those situations? And that's where the training goes into, having that environment with your supervisor and with other staff members up into leadership, to really be able to talk about how we can develop better programs and better tools and scales, so that when our clients come in and we use our outcome surveys, we are looking at the culture and not just based on one population, but diverse populations. Also, how can the staff really communicate their views and their challenges with these microaggressions and biases in an open and safe, non-judgmental area?
Thanks for sharing, Tiffany. We do have a question for folks, because we'd like to hear from you too, around policies or infrastructure that you have going on in your organizations or community that you think are good ways to mitigate bias when engaging with communities. So feel free to share in here. What are some of those strategies that can be used in organizations to help mitigate bias? And I will share while people are thinking that one of the things that we've been working on in our center is how to ensure that, and it was an example I shared earlier, is that we are supporting community members to engage with us when they're serving on our advisory team and sharing that lived experience and expertise. So making sure that we have policies around that to support that engagement is something that we've been doing. But would love to hear from others around other policies or infrastructure ideas that you have in your own organizations. So this is a nice example and one that is so important, right? Like, so setting these advisory team meetings rather than in the middle of the day, because I think there are assumptions sometimes that we make about people being able to attend meetings, also making sure we're providing stipends so that community members can attend. We've had people share with us sometimes in other organizations that have said, we didn't realize that our community member had to take paid time off in order to attend their meeting because it was in the middle of the day. And so I think that is a good strategy to think about. Including community members on hiring committees. That's such a great way to engage the community, and then to also ensure that as you're thinking about biases that can happen also in hiring practices, this is a nice way to add diverse perspective into a process so that you're challenging that. Placing value on diverse experiences and perspectives in hiring rubrics, that's great. Our center also just put out a kind of a tool, not a toolkit, but guidelines around practicing diversity, inclusion, and equity principles when thinking about hiring, training, and retaining diverse staff members. So we'll make sure to post a link to that resource as well. And this paid internships idea, I think that's a really neat way to think about how do you create stronger pathways for community members to enter into the workforce, to be parts of your teams. And so even thinking about how that could look is a good strategy that could be sustainable. So thanks for sharing this. I'll pass it back over to Suganya.
Thank you. So given that we are in the midst of the COVID-19 pandemic, it probably is a really good a conversation to have around how does that then impact community engagement and the kinds of biases that might be actually sort of out there. And I actually wanted to share a couple of things that if we really look at them, these are biases, and we need to be able to understand them. So let's think about what's been happening the last 4 months or so. One of the things we know is that cognitive biases are systematic errors in the way we think, and it therefore affects the way we make decisions and judgments. So if you think about the COVID-19 pandemic, it really has exposed these cognitive biases because it has led us to the irrational behavior of hoarding toilet paper. We've also had, there have been people who have made illogical decisions about the worth of drinking fish tank cleaning solution because it contains chloroquine and that might prevent coronavirus infection. I mean, and this is it's so prevalent. We've been hearing about this. What we do know is that during this COVID-19 pandemic, there's been all kinds of other biases as well, action biases. people have been hoarding food, they've been hoarding cleaning solutions, they've been hoarding paper. Even though we've been hearing from everyone that there is sufficient meat, there were times when you went to the store and everything was out in those meat aisles. And it is because people, even though we hear this information, our tendency is to go with a gut reaction, what if? The fear of missing out. I had not even known that that was a bias. It's called a bandwagon effect. It is, that's why we see these long queues of people waiting in line and emptied shelves. So this phenomena, this bias has really kind of shown up during this COVID-19. I wanted to show just a little thing about it. This information here is, this is California. This is the southern part of California. And what it shows is mortality rates, and the number of mortality rates are the highest if they are in red, and the lowest if they're in very light yellow. Here you have a very small geographic area, and within this geographic area, you have such a diversity in how people are experiencing COVID-19. And so much of it, as Rochelle mentioned, is, the zip code factor. We know that people living in two different zip codes have very different social determinants, and that impacts their health. Likewise, when you think about it, is where are PPEs going? Where is information going? How are people told about using, masks? What are people taught about social distancing? All of those are very culturally informed, culturally defined, and how they have played out in these different areas within this one small area would be very interesting, would be very telling. And the other is, we know that how people in higher socioeconomic areas are experiencing COVID-19 is very different from how people are experiencing COVID-19 when they are in very low socioeconomic statuses. These are all built-in, biases in policies and structures that have been there for eons, and now it's showing up. And so it's something, it's hard for us to miss that this is happening, that bias is making a difference. And so our question to ourselves is, what can we do during COVID-19 that can help us? One, we really need to stop and think. Think about our communities. Think about how we want to engage our communities and what it is that we really want to be able to share with them that would make the truest sense. We cannot deny on our snap decisions or our immediate assumptions, but we really have to build it on data, and therefore it means we really have to be out there in our communities getting the information that will then inform our decision making. So apply slow thinking. The second is, take the time to evaluate the information. I think sometimes what happens is, and we see this, we get information from the media and we're immediately reacting to what we hear in the media. And the thing is, when we think of our community and when we think about engaging our community, the recognition is they're getting information from so many different sources in their in terms of media, and therefore so many biases exist because even the media doesn't provide the same information every time. So really being able to collect that information, find out what people are doing, what are people hearing, and using that information then to address anything that we want to do in terms of engaging our communities. These are troubling times, but it also means that there is work that we can do in really mitigating the bias that might exist. I really like this because it's been something that has helped me think about how do we do this work in the midst of all this chaos to some degree. We will not go back to normal. Normal never was. Our pre-corona existence was never normal other than we normalized greed, inequity, exhaustion, depletion, extraction, disconnection, confusion, rage, hoarding, hate, and lack. We should not long to return, my friends. We are being given the opportunity to stitch a new garment, one that fits all of humanity and nature. And the reason why I felt like this is so critical is that we are doing this work in health equity. We've been doing the work of addressing disparities for some 30, 40 years, and we really haven't made a dent. And so maybe what we need to do is we need to stitch that new garment in how we provide care for people in our communities. One of the things that I've been listening to Becky Margiotta, who's part of the Billions Project, and what she said is few people are powerful, persuasive, persistent, and charismatic enough to change the world all at once. But everyone has the ability to affect the 3 feet around them by behaving more ethically, honestly, and compassionately towards those they meet. And I think at that point she was quoting Sharon Salzberg. So that's important to think that we can do this, and that we need all the stories of all the people in our communities to be able to do that. So I am going to, this question, we will ask you this question, and that is, what is one action that you might take as a result of listening in on this webinar?
Thanks for sharing that, Sagani. And I guess while people are typing in, I just share that on some other projects, one of the things that we're recognizing is that community engagement during this time looks super different, yes. Right? And so we can't get together physically, that people feel stressed, overworked, overburdened. There's just a lot of complex things happening. And so again, just encourage you to think about asking a few trusted partners or allies, like, what should community engagement look like for us? Is it a time to take a pause, or to even think about it really differently because of the current context that we're in? And so just kind of remembering to check our own assumptions that we might be making about how available community members can be right now. And what might be more supportive, rather than asking them to give. Maybe this is the time that we're giving back more and supporting more community members, because there's just not space for it right now.
Oh, absolutely. Just like anything else in the service arena, we're all having to look at new ways of doing things. And to me, in thinking of community engagement as a service, and then thinking about how that could be done can be a very critical step.
Seems like lots of folks are interested in the action tool.
Yeah, I think so. I think we have just a minute or so. So Caitlin, you might want to just do the home run.
Yep. So thank you again, everybody. Webinar recordings, if you want to view our implicit bias webinars, the 3 earlier in this series on clients, the individual, and organizational culture and climate, you can view them on this website. This particular webinar will be available in about a week. A certificate of completion, you will receive one of those automatically, but if you join through your phone only, please email Joanne Oshel at josh@cars.rp.org to report your participation. It'll take a week or 2 for you to receive this. And then something we're excited about, which is still relatively new for us, are optional continuing education hours for mental health professionals. So here are the instructions for those. They're available for a processing rate of $25, payable to the Center for Applied Research Solutions following the event. And their 1.5 CEHs are available for ASW, BRN, LCSW, and the others listed here. And so to purchase the CEHs, you have to complete the survey after the event. You'll be directed to the appropriate link and payment form where you can then pay online via PayPal or by credit card. And if you have any questions about this, please contact Carrie at Pacific Southwest at mhttcnetwork.org. And then as I mentioned before, the MHTTCs offer a variety of free resources, webinars, trainings, products. So we would really appreciate if you took a moment to please fill out our survey. The feedback form will appear on your screen when the webinar ends. And it's also included in the follow-up email that you'll receive immediately after the webinar. And again, we'd really appreciate if you would complete this survey. And here is our contact information. We're also on social media. Please feel free to get in touch with any questions you may have. And we look forward to hearing from you. And if you want to sign up for our newsletter, the link is there to do so. There's a lot of great resources that are distributed through that mechanism. Here's the mission from SAMHSA. We are funded by them. And again, thank you so much. We appreciate you taking the time. For some of you on the East Coast, I know it's quite late. And special thanks to Tiffany for sharing her work at the Nord Center. And I hope you all have a great rest of your evening.